With that, we're on 11, approval of the minutes of August 23rd, 2021. If I have a motion to approve those minutes.
I'd like to make the motion that we approve the minutes of the August 23rd, 2021 board meeting.
Do I have a second? Mr. Hogan seconds. Any discussion? Seeing none, vote for approval. And that's 6-0. It's item 12 is public participation. I will read the board welcomes and encourages public participation. However, the privilege of addressing the board does not include the ability to make personal attacks on any board member, district employee, or other member of the board. We respectfully ask that you adhere to the procedures and decorum provided in Board Policy BEDH, public participation at meetings. Your comments should be limited to 3 minutes. Dr. Harris does have a timer. Questions asked during public participation will be handled in accordance with Board Policy BEDH. And I would just like to remind people when we talk about the decorum, that would be not yelling. Thank you. And let's see, do you have the, okay, and I'll let you read the names. Thank you.
Raina Floyd of Columbia is here to speak about meeting participation and mitigation guidelines.
Good evening. Can you hear me? We're good? Okay, I'll just hold it for right now. So initially I was just going to speak about citizen participation and the mitigation guidelines, but a couple things have come up since the beginning of the meeting. So about participation guidelines, I don't know if it's possible to have a pre-screening, but since COVID has hit and there's been hot topics of concern, some things can be considered controversial, there has been a lot of participation by people who aren't even a part of our district. It's one thing if you don't have a child or even a grandchild in the district, but you're in the district, you rent an apartment, you own a home, you somehow are an actual participant. By all means, please have input. But there are people from other districts coming in to stir stuff up. And y'all, I'm a part of community groups and as a parent, but also as a teacher. And it's embarrassing when other teachers across the state post things about our district meetings that I don't know what can be done, logistically speaking, but if it can be limited to actual citizens like it states on the piece of paper when we sign in, that would be great. The mitigation, the new dashboard looks awesome. I still have concerns about the wording of the mitigation page where there's a lot of should and maybe. It's not very clear cut. And I believe that a lot of the frustration for parents is it's not clear cut. We understand, Dr. Ross, you touched on this, that red means there's not enough supervision and it's not physically safe, but there's things that just aren't always communicated very clearly, and I think that's where some frustration comes within the community. I know that a lot of parents are upset about quarantining. Again, there's the state proviso and there's the current legal issues that are being dealt with, but not as many kids would need to quarantine if people were wearing masks, just a matter of fact. I wanted to touch quickly on the question of dual modality. What was being discussed and proposed that educators create videos of the lesson, not necessarily the Google Meet because there's FERPA issues with that. Y'all, technically, you're asking teachers to do double duty. And while it may not fall underneath the legal definition of dual modality, you're asking educators to do more work and you should compensate them for that.
Thank you. That's 3 minutes. I would say to you, one of your suggestions, we are asking when people sign in that they put their address so that they are a member of our community. That's a very good point, and I thank you. Since you don't have, go ahead.
Dr. Lauren Gare of Columbia is here to speak about communication with teachers.
Good evening. My name is Dr. Lauren Gare, and I am a proud teacher at Dutch Fork High School. A few weeks ago, the district disseminated a video saying, asking how the kids are and saying the kids are not all right, and we've heard the same phrase tonight. With the rising number of cases and quarantines not only in our district but across the state, I mean, this is clear. The kids are not okay, but the teachers are also not okay. This seems to be missing from the rhetoric and propaganda of our district leadership. Before anyone writes on Facebook that I care more about myself and teachers than I do my own students, try thinking about it this way. It's like the announcement that happens on airplanes before takeoffs. You have to put on your oxygen mask before you can take care of others. If we do not take care of our teachers and staff, we can't take care of our students. And right now, the teachers are not okay. Along with the normal stress of any school year, many of us feel that we are not supported by our own school board and parts of the community. This isn't because of funding, but because of words or lack of words, the action and inaction of the board. Many of the teachers in the district send emails to the school board members and never even receive responses. Silence speaks volumes. We can't take care of teachers and staff by just hiring substitutes and contact tracers. We need action, and that action starts through communication. We need our teacher voices and concerns to be heard. We need the board to reach out to the teacher forum, not just talk to them, but talk with them. We need our school board members to be present in our schools and not just at district events. Come see us in our classrooms, come talk to our students, and come talk to the teachers and see why we are stressed and why we are drowning. Teachers are stressed about COVID. Our classes are packed and during an increasingly worrisome pandemic. Most classrooms can't follow CDC guidelines. My own desks are not even 2 feet apart, let alone 3 feet apart, and I have some of the largest class sizes that I've ever had while teaching in this district. Again, our teachers are doing everything that we can. Our administrators like Dr. Gary and Dr. Hardy are doing everything that we can to make sure that we have a successful year. Dr. Ross, I came to this district 4 years ago, and in my Lead D5 session, you came and spoke, and I knew that I made the right decision and came to this district. In order for us to continue to do well in this district, you have got to talk to our teachers. Don't listen to any sensationalized information about what people think is going on in our classroom. Come into our classroom and see what is happening. I need you, Dr. Ross, to lead us and to talk with us and to use your words to help us be successful. Maybe we're all just doing the best that we can, but we have to do this together and we can't do this apart. Please join with us and talk to your teachers and see what is going on in our classrooms. Thank you.
Thank you.
Krista Sorrenti of Chapin is here to talk about quarantine policy and masks.
She's not here? Okay, we'll go to the next one.
Dr. Scott Wheatzel of Chapin is here to talk about COVID-19 risk mitigation.
Good evening. I thank this board for the opportunity to speak this evening. My name is Scott Wheatzel. I'm a local physician, a board-certified anesthesiologist, a military veteran, and most importantly, I'm a parent of a daughter in this proud district. I've sat by idly for the last 18 months and I've witnessed the back and forth in our district, and I cannot sit by any longer. I have come here tonight to address the mitigation strategies that are currently being employed in this district. As you all are aware, our local hospitals here in the Midlands and across the state are working frantically and at high capacity, caring for our families, our friends, our neighbors, and yes, our children too. I can attest to you that this is no joke. It's the real deal. Myself, my coworkers, and all of the healthcare workers across this state are dealing with patients that are very sick from COVID-19 at a far greater rate now than at any other time during this pandemic. I am of the opinion that this district could be doing more and should be doing more than we were even a year ago, particularly given how virulent the Delta strain is and how a large number of children in our district are under the age of 12 and cannot currently receive the vaccination. I note the district's guidance regarding quarantines are directly aligned with the CDC and DHEC. I am thankful and I applaud you all for maintaining that standard. Those recommendations may change as we progress down this road, but I do not think that it should be up to this board to blaze that trail or write the guidance for DHEC or the CDC. I question the social distancing as well in our classrooms. From what I've witnessed, there's little to no distancing between the desks and the classrooms. I realize that attempting to argue a mask mandate is a waste of my time given here. I will never tell you that masks are 100%. I currently wear an N95 much of my day, and that is not even 100%. Without implementing masks as the CDC guidance directs, our schools are doing a poor job at protecting those at risk, at highest risk in our combined community. When we combine masks, social distancing, appropriate quarantines, and vaccinations, there's an exponential increase in the mitigation, in the risk mitigation against the virus. COVID-19 is likely to be with us for a long time. It may unfortunately be with us longer if we don't all really join the fight. I too miss the unity that we experienced 20 years ago after that unfortunate day. A beautiful thing was born out of the horrors that took place on September 11th. Perhaps in the near future, we'll experience a renaissance of unity once we get past this current fight. But we should all remember that the fight is against COVID-19 and not against each other. I thank you for your time.
Thank you.
Dr. Ashley Ledford and Dr. Caitlin Sanzone of Chapin are going to talk about COVID-19 risk mitigation.
I just want to clarify, we get 6 minutes since there's two of us, right?
You each have 3 minutes
Yeah.
if you
Okay.
both signed up.
And we just want to echo what Dr. Weitzel said. We have a whole group of physicians that have been discussing this within our district. I'm a mom of 4. I have 3 that are school age within our district. I work with kids and teenagers all day. I am a physician, and I see them in the emergency departments when they are in crisis.
I'm Dr. Caitlin Sanzone. This is Dr. Ashley Ledford. We're here today as physicians with children in this district who attend the district schools, and we wanted to express our concerns about how District 5 could be doing more to mitigate the spread of COVID-19.
I've seen firsthand the impact of COVID on local children. On Friday night, there was a 10-hour wait in our children's emergency department. That's numbers we've not seen before. There were multiple severely ill children in the ER with COVID waiting on hospital beds. The number of children hospitalized with COVID in the state continues to rise. The number of children needing ventilators because of COVID is increasing. Pediatric ICUs are full. In addition, 1,400 students in the district are currently out of school, including mine. They either have COVID or have been directly exposed to COVID at school. They are missing out on important education because of the spread of this virus.
So we all know that getting the COVID vaccine is the best way to protect our students and our community from this virus, but children under age 12 are currently not eligible to receive the vaccine. This includes all children in the District 5 elementary schools. The next best way to protect our children from COVID is to require everyone to wear a mask. If everyone wears a mask, that does a better job at mitigating the spread of the virus than if just some children or just some staff are wearing masks. A mask protects other people from you more than it protects the person wearing it. And we know as physicians, we have access to N95 masks that have a much higher ability to protect the wearer, and kids don't have access to those. But if all kids, all staff were wearing masks, that would protect everyone in the classroom. It would also prevent unnecessary quarantines. DHEC guidelines state that if a COVID-infected student and the exposed student are both wearing a mask, the exposed student can stay in school instead of being quarantined. And we all agree that in-person instruction is the best thing for our children. There's an argument that parents should decide what's best for their kids with regard to masking. This doesn't really make sense. We mandate lots of things to protect our children, like in a car they have to be in a booster seat and wear a seatbelt. And to go to our schools, they have to be vaccinated against things like measles and polio. The district has a responsibility to promote the well-being of all children enrolled at its schools. DHEC, the CDC, pediatricians, and other public health experts support mask requirements in schools.
They get, I think since they
Second
planned
3
it together,
minutes.
they get the
Second
6.
3 minutes.
Yeah.
There's no research to show that wearing a mask harms children. In fact, wearing a mask will help protect children from COVID and other infectious diseases like flu and RSV, which is about to soar. Unfortunately, the only thing masks harm is political gains. We asked the interim superintendent and the board to institute a universal mask requirement in all of our schools. We understand that the current South Carolina budget has a provost preventing the use of state dollars to be used in enforcing a mask mandate. This was passed when the transmission of COVID in our state was at an all-time low. It does not make sense any longer. Please act to support our children and keep them in school. I've been in touch with Governor McMaster, and he has agreed to meet with the physicians to look at this issue again. I've talked to his chief of staff, and I'm awaiting a call back from scheduling to revisit this. Dr. Ross, what you were talking about with 9/11, where we all pulled together, I wish we could do this for our children, because I see the kids that are on isolation. They're not doing well. The children is definitely far from doing anything well. I want the kids to be in school. I want them to be able to participate in sports and other extracurricular activities. As you can see, games have been canceled. Events are being canceled because of quarantine. And we have to do all that we can to support our kids and keep them safe. And if you're not allowing a mask mandate, then that is not doing everything we can to protect these kids. I work with kids and teenagers all day. I can tell you for a fact they're not going to wear a mask until they're told to do so. That is a requirement, just like all the other rules in school. And I will speak to, you may hear a lot of health professionals talking about masks not working, anti-vax, whatever. But unfortunately, when you deviate from the standard of care in medical practice, that is a concern for liability. So I would caution you to really examine that, because we want our kids safe. That was Tom? Oh, sorry, I'll keep going.
It's a minute, right? Minute left?
I think that's all you want to say. Thank you.
Thank you. We appreciate that. All right. What's another one?
Jerry Emanuel of Columbia is here to speak about COVID.
Just Columbia? What's the address?
My name is Jerry Emanuel. I've been a sub in this district for the past 12 years. I work every day in one of the 4 high schools or one of the 4 middle schools of the district. I am here to urge this board to encourage parents to send their kids to classrooms fully masked. They're sending their kids, vaccinated or not, to class, and they're sitting next to other unmasked children. Not 6 feet apart, but 2 feet apart. Not 8 to 10 kids in a classroom like we had during the virtual classrooms, but with 28 to 31 kids in a classroom built for 24. Some of them are asymptomatic, meaning they have no symptoms at all, but they are carriers of the virus. We've also learned that those of us who are fully vaccinated can get the Delta variant, which again increases the danger in the classrooms. Those of us who stand in front of a classroom every day we try to keep your kids safe. That's our major feature, obviously, besides teaching. If everyone were masked, it would go a long way to ensure the safety of the kids and the children in your district. And it would also go a long way to defeat the virus. Thank you.
Thank you.
Stacy Price of Chapin is here to speak about contact tracing and quarantine.
Hello. A little bit different than the last speakers, but so I have a couple of things. The quarantine with the live stream of class. I'm not here with answers, but we're 2 years into this pandemic, and we have students sitting at home that are healthy, that can't have access to what's being taught in their classrooms. I think that that's unacceptable for a school district with this much money. Pay the teachers. I know a lot of them are burnout. The money may not be the main issue, but they're burnout. They should be paid more anyway, but that's another fight. But, for a healthy student to be sitting at home and they get packets or whatever, in some cases, we're asking those students to basically teach themselves because they may not have parents at home that can help them or parents that are able to help them. I just think that as far along as we are in this process, that there should be a better answer. And the questions that Ms. Hines asked, I didn't hear an answer. I heard more of, yes, we're doing that, or no, we're not doing that. I just think that, and I'm here to help. I would be willing to help in any way I can to come up with some solution. I don't know the answer, but I just feel like we should be further along with this. Then I had a question about the testing and the cost of the test. When my son was out, I was gonna try to get the at-home test, the 2-pack for $24. I don't know if it would have been accepted or not. Now, you can't find them right now, but I don't know if that could be a solution rather than doing tests, is you provide those tests for them to do at home to be able to come back soon. It's just a thought. And then, I know that you mentioned about volunteers, and I know we can't be in the schools, but we all have a lot of opinions, and I'm one of them that has a lot. But a lot of us are willing to do whatever we can do to help, even if it's not being at the school, come up with solutions. How do we unify? We've tried. It doesn't, it may not work, but if we had some sort of facilitation efforts with people that do have all these opinions about what should and could happen, we're all willing to help. But some of us can't. Some of us do work, and we may have 5 hours, but it may not be 5 hours that you need the help of a bus driver or what it may be. But we are, those of us that are in the schools normally for the past 2 years, we haven't been there. We are on the side of our seats wanting to be in there to help teachers and help any way we can. And then the vaccinated, I'm not a doctor, but it sounds to me like vaccination, you still spread it. So I don't understand how that is a way to get out of quarantine. If you can still spread the virus, have the virus, be asymptomatic, but that is a way for you to come to school. So it's vaccinated, you can be at school and you don't have to quarantine. It doesn't make sense to me, but again, it's not my area of expertise. But thank you all. Thank you.
Kim Murphy of Chapin is here to talk about finance transparency.
Good evening. I appreciate the transparency that you all have brought to the district, Dr. Ross and board members, like the Procurement Committee and the Facilities Committee. And at the last meeting, there was a great presentation from a potential financial advisor related to financing capital projects and how you can strategically plan your financing around your needs. I'd like to hear more of that. And at the workshop earlier tonight, we heard a bit about the debt service millage, the amount that taxpayers will be paying for this upcoming year for building projects, and a deadline coming up on September 27th to either keep the millage rate the same or potentially lower it. We have never had this much transparency before. Thank you very much. I look forward to seeing your follow-up discussion at the next meeting on the possibility of reducing the millage because, I'm going to find my notes here, sorry. We discovered tonight there's a apparent excess in the funds that have been accumulating during the past few years from the millage rate. And your back and forth discussion and open questions and answers is very informative and it's refreshing. And, keep it up. Thank you very much.
Thank you, Ms. Murphy. Is that it? One more?
Unless Ms. Sorrenti has returned to the room, that will conclude public comment.
Okay. Well, did that person come back? Okay. Thank you so much.